looking up here. How are you today?
Could be better.
Could be better.
Yeah.
Bit of a rough start to the day.
I don't know. I feel anxious about the whole thing, but it's good that I'm here.
Okay, it is good that you're here.
Yeah.
Rest assured that we'll just work through things slowly. You're in a safe space, so if you need a bit of time, if things aren't working out for you, just let me know and we can take our time and I can clarify things for you. I can look at things again if you need to. So it'll just be up to you to give me that information.
Thank you. I really appreciate that.
Okay, thank you. Just as a reminder before we start that this is being filmed, I've put it at the back so that they can't see your face. It is only for training purposes, for assessing me. So there's nothing to do with you. It's all about me.
Okay.
Okay, are you comfortable with that?
I guess so.
Okay, alrighty. There are a few things that we do have to run through. I will use the PowerPoint just to make sure we don't miss anything. There's a couple of activities that we'll do, so if you're all good, we'll just get started.
Okay.
So this is the unit CHCCCS012, which is prepare and maintain beds. So they're the things that we're going to be looking at over our sessions together. So we proudly acknowledge the Australian Aboriginal and Torres Strait Islander peoples and as the first inhabitants of this nation, and the traditional custodians of the lands where we live, learn and work. We pay respect to elders past, present and emerging. Okay, as I said, this is being filmed, so. Okay, so just a couple of housekeeping things first. If you've got a phone, if you can just have it on silent for me, just so that we're not disturbed. But if you do need to use your phone, that's fine. Just let me know and you can step out of the room, okay? Or I can step out of the room one way or the other. The toilets are just outside the door. Our assembly points out the front of the building. So as you just walk out the front door where you first came in, there's an assembly point there. And if there's any emergencies, obviously I'll just guide you through that. So that should be okay. Just make sure you're comfortable sitting up in your chair. It's only a short session, but we still, need to maintain our comfort and don't end up with a sore back at the end of it.
Yeah.
And there is a cord running on the floor, so I need you to be really mindful of that. I have taped it, but still, don't trip on it if you do need to get up and go away. So just a couple of things for us. We both have the right to speak and to be listened to. So, with the two of us, it makes it very easy. We just have to be respectful and listen to each other. No one's opinion's wrong. Okay, we can discuss it, but it doesn't mean things are right or wrong. As I said, we'll be respectful to each other. Participate to the best of your ability. And I understand that, you may need a little bit of extra time or an extra break, and that's fine. You just need to let me know. We spoke about your phone, and I do ask that, while you're in class here, that you do only do the work that we've got together, but you don't have your laptop today, so there's no temptation for you to be working on something else. Okay. So just as a little bit of an icebreaker, this is an interesting question. Would you rather have every traffic light turn green or always have the best parking spot?
I'd rather have a best parking spot.
Okay.
Yeah.
Do you have a reason for that?
Well, I love my car.
Okay, so you want to make sure it's safe.
It's safe wherever it's parked. Yes.
Yeah. Okay. And this is an interesting question. If you get into a bigger group of people, obviously you'll have a lot of different responses. But it sometimes it kind of indicates if people are going to be either practical or patient. So a lot of people that are impatient will want to get every green light, okay, because I want to get there as soon as I can. But the practicality about it is that if you've got the best park, well, you're set, and the lights are going to change anyway as you go along. So I'm probably a best parking girl as well.
Yeah.
So, all right. So we are going to talk about personal protective equipment today, and this is an important part of preparing and maintaining beds that we do need to learn about. So we're going to have a look at what PPE is, why do we use it, and then we're also just going to have a bit of a discussion about if you've ever had any experience and what types you've used. So what do you, I'm going to write down your answers if that's okay, just so that we can make sure that we cover everything and come back to it. What do you think PPE is?
It's a personal protective equipment, clearly, and to protect ourselves and others from contamination of any sort.
That's right. What about, so as you said, we use it because we're protecting ourselves and others from any sort of contamination. Have you had previous experience using PPE at any time?
Yeah, sometimes we use masks, you know, with the COVID and the public places. The GP clinics tell us to put the mask on.
Yep.
Yeah, I don't like those.
Don't like
it makes
wearing
me claustrophobic.
It does for a lot of people, doesn't it?
Yeah.
And I think we know as well that when masks were initially introduced at the beginning of COVID, people, you know, were getting such terrible rashes and skin conditions and all sorts of things. So even though it's protecting us, it does have its downfalls as well, doesn't it?
I can't breathe with the mask on.
Yeah. It does make it very difficult. Do you have some strategies in place if you're wearing it? Are you able to leave the building and get a bit of fresh air and then restart, or?
I just try to avoid going to public places.
Yes.
Yeah. And if I have to, I just wear a loose mask. I just can't have it on.
And for the shortest time, I presume that you're going there. COVID certainly brought PPE into everybody's mind, didn't it? For anyone who didn't know anything about it, there was that component about it. So what about, do you think other industries use PPE other than the health industry?
Oh yes, I think people who like work in restaurants and everything, they wear gloves and hairnets, and I think all industry would need some form of PPE.
Some form, that's right, because if you're, for example, if you're a builder, you might wear steel cap boots or something like that, and we don't necessarily think of it as PPE, we just think of it as what we're putting on to go to work, but you know, it serves the purpose of protection for the person, doesn't it? So not necessarily from contaminants, but it does protect them. So if we look at the official description of PPE, this one comes from the Australian Nursing and Midwifery Federation. So I've kept it a sort of a medical one because where we're working is more relevant to us. So personal protective equipment, or PPE, refers to equipment designed to protect individual workers from exposure to infectious diseases or hazardous chemicals. Okay? And the thing about it is it doesn't only protect us, it also protects the people that we're dealing with. So we want to make sure that we don't spread diseases or spread illnesses between our patients or the people, the clients, the people that we're dealing with. So you spoke about masks as one form of PPE, but for our purpose of cleaning and maintaining beds, there's other sorts of PPE that we need to use as well. So gloves are one very common thing. There may be the need to wear goggles or eye shields if there's any sort of splash or...
Sorry to interrupt. Are you going to get me to put all this on today?
No, I'm not going to get you to put it all on today.
Okay.
We are just going to put gloves on and off, and I will work through that with you and show you how to do that. You don't have an allergy to gloves that you're aware of?
Not that I know.
Okay, good. Some people can have allergies to the powder or the type of gloves.
Yeah.
But so you don't have a latex allergy. Not that these are latex, but
Not that I know of. Yeah.
all right, okay. And we will have them on for such a short time, so they will be the only ones we'll be using today.
All right.
Okay.
Because I'm like, there's so much. I didn't feel like I was prepared for all this, but that's good that we only do masks. So one thing at a time.
Yeah. All we need to do, all we will be doing today is identifying them and recognising what they are without actually putting them on other than the gloves. Okay. That'll be okay.
That should be fine, I think.
Great.
Yeah.
All right. So as I said, there's also goggles or face shields. There's gowns. And then there's different sort of masks and gowns depending on the area that you're working in. So if someone's had some sort of disease or illness like COVID, you'd obviously have to protect yourself a lot more than if you were just cleaning a bed that, you know, a person had come in to have their appendix out, for example. Okay, so we need to be aware just of the different sorts of PPE. So one part of this is how do we know what we need to wear? How do we know if we need to wear the waterproof gowns or if we need to wear the full regalia, or can we just wear the basic equipment? So we will find that in policies and procedures within the place that we're working. So that'll be something that in the workplace you should have an induction to, and they should show you where all the policies and procedures are. So what I've got here is an example of a policy and procedure, and I'll just give you, I won't bring it up on the screen, I think we can just look at it this way, it will be just as easy. And if we have a look at this one, it's Happy Valley Hospital Bed Cleaning Policy and Procedure, so there may be something similar to wherever we are. And if we look at the procedure, so it tells us in our preparation that we perform hand hygiene and wear appropriate PPE. Okay, and then it goes on to what we're doing, and then it's listed the required PPE. So in this workplace, we need to wear disposable gloves, a disposable gown or apron, a surgical mask, and eye protection. Okay, so that's for when we're cleaning the bed. It then goes on to explain that if we're cleaning after a patient has an airborne infection, we need to use a different sort of mask. And it also tells us if there's large spills or gross contamination, we need to cover our feet as well. We need to put boot covers on. Okay, and how do we know that that's what we need to use? Because it's okay to say it here, but how do we know if there's an airborne infection in the room, or how do we know those sorts of things? And that's where we need to be checking with the person in charge of the area that we're working. So it may be a nurse, it could be a cleaning supervisor, but that information should be shared amongst all the staff so that we know the appropriate PPE to wear.
So they will always tell me?
They should always tell you, yes.
Okay.
Okay?
Yeah,
So
I don't want to do the wrong thing.
Of course, no, and you want to keep yourself safe, and you want to keep everyone else safe. So if at any time you're not sure, it's just a quick question that is this a routine clean? Okay, or is there any special PPE that I need for this clean? Okay, and you should easily get that information from the person in charge of the area.
Okay, so do I have to call them, or how do I know?
So it will depend on the way that they let you know. Different places will have different systems. So there may be a verbal request for you to come and clean the bed. So perhaps a phone call to say, you know, a Peter bed 6 needs to be cleaned and remade. Can you do that? And it would just be the question of, is there anything special that I need, or is it just a routine clean? Some services have online requests where you just go in and find it. It should be included in that, but if it's not, you contact the person that sent the request. Okay. So, and quite often when you're working in an area, you do know if there's been contaminants in the area. You know, you do know if people do have COVID, or if there's been a gastro outbreak or something like that. So that information is shared within the workforce. So that'll be at things like handover if you're involved in that. If you're working in a role that's not involved in handover, your team leader of that area should also let you know, because of the tasks that you're doing, that there's risk. Okay, so that should help. Okay, so what do we need to clean and make a bed? So we just spoke about this PPE, so now we just need to see what it looks like. And we have here 4 different articles that we would use to clean a bed, okay, for starters. Because when we're making a bed, everything's now clean, so, and we're using clean linen, so we don't need the full PPE. We put on our PPE, which is dirty. After we've done it, dispose of it, and then we can start fresh. So if we have a look at these things, we need a disposable waterproof apron. Okay, so the picture in the left-hand corner, just a plastic apron is normally adequate for your routine cleaning, just to protect your clothing. We wear goggles or protective eyewear, and wearing glasses isn't always adequate, because if you have a look at these goggles, they've got the side bits as well, so it protects you from even further risk of splashes. Disposable gloves, which we will further look at, and the face mask that we're familiar with. Okay, hand washing or sanitising must be used prior to using PPE and afterwards. Okay, so wearing gloves isn't enough to think that your hands are clean. You have to clean them again afterwards. And these are the types of things that, you know, you may be told that there's extra things that need to be used. So it's things like a long sleeve gown, like a face shield, the shoe covers, or different chemicals can be required depending on the cleaning that we're doing. Okay, so we're going to have a look at putting our gloves on and off now, and I have got a YouTube video that will go through it for you, and then I'll show you, and then we'll practice. Okay, so we've got multiple opportunities here for you to see how we do it.
Stomach pain with cramps.
I'm an infection prevention specialist at UT Physicians. Joining me today is Jeff Lindsay. He is a nurse with UT Physicians, and we're going to be showing you how to don and doff, or put on and take off gloves. Take it away, Jeff.
Before donning gloves, always perform hand hygiene. If you have any questions about hand hygiene, please see the related video. Take a pair of gloves from the glove container. Make sure to select the correct glove size. Place fingers into the first glove and pull the glove onto that hand. With the non-gloved hand, place fingers into second glove and pull the glove onto that hand. If you notice any rips or tears in the glove, then replace the glove. And remember that if you're wearing a gown, the gloves go on top of the gown. And for doffing gloves, the outside of the gloves are contaminated. Using a gloved hand, grasp the palm area of the other gloved hand and remove the first glove. Hold the removed glove in the gloved hand. Slide fingers of ungloved hand under the remaining glove at the wrist and peel off second glove. Discard the gloves. Remember that gloves do not replace hand hygiene. You must perform hand hygiene when taking off gloves.
Okay, so they were using the words don and doff, which basically mean don is to put on, doff is to take off. And these are the steps that that they went through. So we perform hand hygiene, and I might do this as we go through it, just as a demonstration for you. Okay. So we're going to perform hand hygiene, so we make sure our hands are clean before we start. Get our gloves.
Do I do it as well?
You watch me this time, and then we'll do it together next time. So I've got my gloves. I then just have to putting them on's the easy bit. Okay, putting them on, and then we put our second glove on. Okay, and we just we make sure there's no rips or tears, that everything's fine. Okay, so we've got them on. Then to remove them, we get, this one's probably a bit tight. We get them and pull them down, making sure we don't touch ourselves, and hold it in our hand, just so that we can wrap it up. Fingers under the cuff, and then pull it through, and we put it in this bin here. Okay, hand hygiene. All right. How does that go with you? You think the steps are easy enough to follow?
I think I can read and go slowly.
Yep.
Yeah.
Okay then. I've got the instructions back up for you. So let's give it a go. Do you want me to read out the instructions as you go?
I think that would be helpful.
Okay.
Yeah.
All right. So perform hand hygiene is our first step.
So just, how much do I take?
Just one little squirt,
Okay.
enough to make sure that it gets all of your hands.
Yeah.
Fronts and backs of your hands between your fingers as well. Okay. It always makes it hard to put gloves on once you've done this, because your hands, you know, get a bit sticky, don't
Yeah.
they? Yeah. Okay. All right. So our next step is to select the appropriate size gloves, and unfortunately we just have the one size here, so hopefully we'll be. So they normally come in small, medium, large sizes. So take 2 gloves out. So just like putting on any sorts of gloves, the thumb's around this side.
Oh, okay. Ah, I didn't realize.
So just like a normal
So,
pair
yeah.
of winter gloves.
Yeah.
Yep. And then pop your second glove on. Identifying where the thumb is makes it easier. Great. Okay, so your gloves are on, you're all ready to do your task.
Yeah.
Okay, so once you've completed your task, obviously your gloves are considered dirty because of what you've been doing. So to remove them, we, as the instructions say, using a gloved hand, which we've already got, grasp the palm of the other gloved hand to remove the glove. So we take it from the middle, either whichever one you want to use first, it doesn't matter. Take it from the middle and peel it down.
Alright.
Yep, just keep peeling, that's great. Now screw that up into the palm of your hand,
Yeah.
and that way you ensure it stays enclosed when you remove your second glove.
What if
Okay?
I drop it?
If you drop it, you leave it on the floor until you have your other hand ungloved, clean. If you drop it, you can pick it up with your gloved hand, If you drop it, pick it up with your gloved hand and put it straight in the waste,
Okay.
okay? And then proceed to remove the other glove. So now slide the finger under as you're doing, and then just slide it off. And then you can just pop it in this bin down here.
Yeah.
And then do hand hygiene again. You did that really, really well.
Oh, thank you.
That was
I was
good. There was,
really worried. I thought I wouldn't be able to do it.
and you've done it. And there was at no time did you touch the contaminated part of the gloves.
Because
Okay.
I don't want to take bacteria home.
Of
'Cause
course
I
you
work
don't.
in Family.
Of course, yeah. And that's why, making sure that you sanitize afterwards as well, that you
Yeah.
need to make sure that, everything's okay. All right. As I say, you did really well with that.
Thank you.
Okay.
Yeah.
So, are you comfortable with that? We will practice again during other sessions, but
I think I can do it, but yeah.
Yeah.
Just going slowly because otherwise I'll confuse use.
That's
the
right,
steps,
and
yeah.
you've got the steps available that, you know, if you want to practice at any time out of class, you can just go through it as well.
I'll just have to take time.
Okay, so we've done that. So what we're going to do now, have you got any questions about anything that we've done so far?
No, I think it was really good.
Okay, great.
You explained very clearly.
Okay, I've just got a handout now for you, just to remind us of the names of things. And across the top of the page, the titles are listed. So number one is a face mask.
Yeah.
So can you identify the face mask there? Yep, the goggles. This is just so that we use the right terms when we're talking to people about PPE. The next one's the disposable apron, disposable gown, and face shield, and then the gloves. Okay, so you're all over that. Okay, you can easily identify what appropriate PPE is, so that's really good. So today we've had a look at what is PPE. We've identified it. We know how we select, where we need to look for selection, that policies and procedures are in place for it, and we practice the application and removal of gloves. So we've got through all of those things that we were hoping to get through today. So now comes a little bit of revision. All right, so we can go through this together. Are you happy to try and write your answers in initially?
Yeah,
And then we can talk about it.
Instead of talking, I'll just read.
And there are words down the bottom you'll see, just to help prompt you with the answers. So I'll just give you a minute to do that, and then we'll go through that together. All good?
Yeah, I think so.
Okay, all right. So the first one is PPE is equipment that is used to protect workers from exposure to
Infectious diseases or hazardous chemicals.
That's right. And that was pretty much something that you identified in your initial understanding of PPE, wasn't it? So you're protecting yourself and others from contamination. So you were right on the money there. Policies and what are available to assist with selecting PPE?
I think it's procedure.
It is. And we did look at that, didn't we?
Yeah.
Additional
PPE.
Yep, may be required on some occasions. Check with a senior staff member.
Yeah.
Gloves do not replace hand.
Hygiene.
That's right. We do need to make sure that we hand hygiene before and after.
Yeah.
Any rips or tears in gloves, they need to be
Replaced.
That's right. And then we went through the application and removal, and as I said, you did a really good job with that. So you're all over that. Any more questions? Anything you're unsure of? Anything I didn't explain well enough?
I think I'm pretty good. I think we'll just practice more and I'll get better.
Yep. Okay. And you've done really well. You've participated in the session, so it's been a really good session.
Thank you.
So next time we'll be talking about stripping, cleaning, and making a bed. Okay, so we'll use what we've learned today and take it into the next part of the process. Okay.
Yeah, sure.
My email's there, and when you go back and open your Moodle shell, there's a contact there. If you think of anything before our next session that you're not sure about, by all means contact me.
Yeah.
And there are some references there on the PowerPoint that you can access if you want further information, because some of them do go into a lot more depth than we've spoken about, if you're interested.
Thank you.
Okay. So nothing else that's concerning you in regard to this?
So would the next session be here?
Yep, so it'll be in the same place. We will just do a one-on-one session again, just to give you that extra support so that we can, work our way through it and make sure that you feel comfortable with where we're going.
Yeah.
So it will be the next session once again, as I said, that will be cleaning, stripping, cleaning and making beds. Further on in the course there'll be opportunity to actually practice that. So this will really be the theory part of it. I won't be expecting you to, obviously we don't have a bed in here, so I won't be expecting you to actually physically do it, but we will have opportunity to practice. The same as I said, we'll have further opportunity to practice with your gloves and putting them on and taking them off at other times as well.
Yeah, I would like to do more practice with that, and also this says that you have to put on gowns and apron and everything, so I'll be really flustered, putting everything on at one time.
Yeah, it is a lot to learn initially once you get into it, but we will have opportunities to practice. One part of this unit as well is there will be some assessments at the end of it. So one of the assessments will be questions and answers that you can work your way through, and there won't be any questions on there that are on any information that we haven't covered. So you will be able to find all the answers either through the PowerPoints, through other information that's supplied to you, and the date is recorded in the Moodle shell for you, and it is on the learning program so that you can have a look and check when that's due. It's not due until after I've provided you with all the information, okay? So you don't need to know anything before as such. The second assessment is actually you making beds and different types of beds. So obviously for you to be assessed on that, you need to be given opportunity to practice. So we'll go through the theory, we'll go through the practice, and then there'll be different scenarios that you'll be assessed on for making the beds.
So
Okay.
what do you mean by scenario?
So we might say things like, on this occasion the person is still a patient and you just need to make their bed for the day. Okay, so the way that you would make a bed for the day is very different to the way you would make a bed if a patient had been discharged. So your next scenario may
the
be
infection.
Yeah.
Okay.
So the next scenario may be that the patient has been discharged and you need to clean and make the bed. There may be another scenario, for example, where somebody has had a needle in their arm that was removed and there's blood on the sheets. So how do you deal with that? They're still a patient, but you need to deal with that sort of thing. So
that's a lot to take in.
So we'll do it step by step, and they're all the things that we cover over the course of the information, and then by doing practice sessions as well.
Okay. Thank you.
So there's nothing that we would expect you to do that we don't prepare you for. Okay? So that's the way that the rest of the sessions will work.
Yeah.
Okay?
Yeah.
All right. As I say, any questions, any other concerns, please just email me and I'll get back to you as soon as I can. I don't work on Fridays, so just keep that in mind that if you are emailing me, it may take a little bit longer if it's the end of the week.
Yeah.
All right.
That should be fine. Yeah.
Okay.
I will contact you over the weekend. Yeah.
Okay. Thank you very much, and I will see you same place, same time next week.
I look forward to it.
Okay.
Thanks for your help.
Thank you, Arpita. Thank you.